It's time for episode 79 of The Crisis Show here on Google Hangouts, on YouTube, and wherever else you have this link around the world. The Crisis Show has now been seen in more than 100 countries since it began in June 2012. Good evening from New York. My name is Rich Klein. I'm president of Rich Klein Crisis Management and founder and host of The Crisis Show. I'm also the Crisis Management Advisor on Google Helpouts. Tonight, we're going to take a look in this abbreviated edition of The Crisis Show. We're going to take a look at this evolving Ebola crisis, which is of concern, obviously, to everyone in the world. Today is Wednesday, August 6th, and there's a lot of news around the world about this crisis situation. But ground zero for the crisis at the moment seems to be Emory University Hospital in Atlanta, Georgia, where two patients from West Africa have been received for treatment. So we're looking at right now Emory University Hospital's news center. And real quickly, I just want to say that this institution has done a great job in communicating with its critical audiences. First of all, they're using their website brilliantly. A lot of detail chronologically going back to a letter to the community last Thursday announcing that the first patient was going to arrive there, and then with follow-up chronological information as things developed. They also did a really good job here on Friday, August 1st, Ebola virus infection questions and answers. What that does, folks, is it preempts so many potential media questions that are obviously going to inundate an institution like this when you are the center of attention in a crisis situation. So some real good lessons here. Use your website. Think of the obvious questions and the not so obvious questions that the media and other critical audiences are going to ask you about your crisis. And that will make the crisis situation a lot more manageable. Now remember, Emory University is not in a crisis situation, but they're treating it as a media crisis because they are inundated with phone calls and emails, and as you'll see in a minute, in their recent press briefing, cameras, video news cameras from around the world. So they did a really good job in preparing for this. Once they learned they were going to receive a patient, it's very clear that the media people, and I give them a lot of credit, the media people at Emory did their due diligence in preparing for what they knew would be a media onslaught. So a real good job there. As you can see here, they're also very well connected on social media. We'll look at some of these social media channels in a moment. But first, I do want to bring you to something that really impressed me, this video Q&A that Emory did. It was based on a press briefing yesterday. So let's have a listen.
This program is brought to you by Emory University.
Ebola virus is an infectious disease by a virus which is part of a group called hemorrhagic fevers because patients who have severe illness hemorrhage from multiple body sites. Unfortunately, as of this date, there is neither a vaccine or a treatment which is FDA approved for the care of patients who are infected with this virus. The main reason that we know we can help them is because the primary care for somebody with a hemorrhagic fever, and specifically with Ebola, is supportive care. And we know that we can deliver a substantially higher level of care and a substantially higher level of support to optimize the likelihood that those people...
Okay, so we'll stop it right there just to give you a little flavor. A couple of points here. First of all, as you can see, many cameras there. But what Emory did, which was really smart, was that Emory recorded the press briefing on its own and then created a summary of the key points in this end, created their own video, put it on YouTube and their website, and I'm sure they shared it as well on these social media channels here, Facebook, Twitter, and so forth, which is the right thing to do. The reason this is a good lesson for you folks out there in the business and nonprofit, higher education world is that you can't depend on the news media to get your story right. And you can't depend on the news media to include all the key information that you want to provide. So what Emory did was it recorded the press briefing, so it had a full record, and they probably edited it down into what appears to be a little less than a 5-minute video highlight reel. And they did a really good job. As you can see, they also had some presentation statements as well. So it wasn't just this doctor, who, by the way, I think is a good spokesperson, but they also had some things in presentation mode to explain the virus. So a really good job. As you can see down here, they have other resources, more Q&A about Ebola virus. Let's just see what that. Oh, actually, they didn't. They got rid of that page. Okay, so that was a little mistake, but really good job here. I also want to take a look at their Twitter feed. This is again Emory University. They put up this video, highlights of the remarks. They just put that up today. They're talking about a potential vaccine, and what they're also doing really well here. They're including in their Twitter feed. They're also including other relevant organizations in their Twitter feed. This one is another one we're going to look at in a moment. The Centers for Disease Control, CDC at CDC.gov. So they're not just talking about themselves, they're talking about the disease as a whole and getting other organizations involved. Here is an interview that a nurse did with the Washington Post, so they posted that to their Twitter feed. That's also a very good use of their Twitter to show their other media coverage. So I want to just first of all commend Emory for a really fine job. Folks, I talk often about the 3 key timelines in a crisis: before, during, and after. And very often what I see in my business is that many companies and organizations they're in a reactive mode when a crisis hits. Emory knew when they first learned that a patient was going to arrive there, they were smart enough to realize that it was going to be a media onslaught, even though they are not themselves in a situation where they did something wrong, that kind of crisis. But the kind of crisis they're in is they have to protect the public from this virus spreading. They have to reassure what was likely a very nervous public, particularly in the Atlanta, Georgia area where the university is based, to make people calm and help them understand how the disease gets spread and how it doesn't, more importantly, how it doesn't get spread. There's a lot of myths out there, a lot of misinformation that needs to be corrected, and Emory was smart enough to make sure they handle those questions on the preemptive side as well. So really good job. So we're going to turn now to just go across my tabs here. This is the World Health Organization, which has 1.4 million followers. So they're also obviously a very influential organization. They are doing a lot of things regarding this crisis. We're just going to look back at some of their recent tweets over the last few hours and few days. They're talking here just a basic statement that there's no registered medicine or vaccine against Ebola. Reminded people of that, but that there are certain options under development. They're talking about a panel that's going to discuss this use of experimental medications. So they plug in this panel. They're going to convene this panel of medical ethicists to explore the use of treatments in the ongoing Ebola outbreak in West Africa. So they've done a good job here, at least in the last few hours, few days, of talking about Ebola. This is the World Health Organization website. They're right at the very top of that page. A good job by highlighting this. They're going to convene this ethical review of experimental treatments. They, like Emory, have social media channels. We see Twitter, we see Facebook, Google+, and YouTube. Folks, the example I'm using here is really because all of you out there watching, whether you're a CEO or other executive in a company or organization, you want to use your website intelligently when there's breaking news, breaking crisis news. You want to make it easy for people to find your information. Both Emory has done that, and here again, the World Health Organization. And in both cases, again, using social media. I'm going to just, and I haven't looked at these prior to just the moment, but here's the Facebook page for the World Health Organization. I'm just scrolling down here for the messages about Ebola. I'm not sure. Let's see, August 4th. I'm just scrolling down here. Well, they probably could do a better job. It looks like from what I'm seeing here, and this is August 6th, they could do a better job at putting up some information about Ebola. They've done it on their website. It appears here they're talking about other subjects, which of course is fine. But when there's a crisis in your company or organization, you want to keep the conversation on the subject. They're talking about a lot of other things on the site, which is understandable. But I would have liked to have seen more posts on the Facebook page about Ebola. In fact, I have not seen any as of yet. What's possible is that that the people running the WHO website are not the same people running their social media. I don't have any concrete evidence to that, but as we just saw a moment ago, they've done a good job on their website talking about Ebola front and center, but then you go to the Facebook page and there's no synchronicity, if you will. There's no stories on the World Health Organization Facebook page in the last few days. And as I said, I haven't found anything. I'm scrolling down for the first time right now about Ebola. So make sure that if you're going to post important information about your organization, particularly in a crisis, that you put it on your website. So what we're seeing here, I just found it, July 29th, which is kind of old information. That is the last post that I can see about Ebola. And today is August 6th, almost a week ago, about a week ago actually, that was the last post. So to continue, we're now going to look at Mount Sinai Hospital in Manhattan, because just earlier this week, a patient walked into the emergency room of Mount Sinai, and either he or she thought they had Ebola, or the people in the ER treated it as such. And what was really interesting here, folks, is that Mount Sinai, watching what was happening at Emory and keeping on top of this Ebola outbreak, prepared internally for taking in a patient who may or may not have Ebola. And from what I understand from news reports, within 6 or 7 minutes, that patient was isolated from the patient population and the medical staff. So I want you to take a listen here to Mount Sinai Health System CEO Dr. Kenneth Davis, who did an interview on CNBC this morning talking about this situation, and a really interesting interview. So take a listen.
A very high public fear factor. There's a lot of misinformation that's out there. But what can you tell us right now about the gentleman who showed up at Mount Sinai with some of these symptoms?
He's stable, improving, and in good condition. We believe that it's unlikely that he has Ebola, but we have sent his blood to CDC to test for the virus, and we'll have a definitive answer today or tomorrow.
Today or tomorrow. When you say that he's stable and improving, that in itself sounds like it's not Ebola, correct?
Could be. It's a good sign. There are lots of things that can present with the symptoms of high fever and GI distress, nausea and vomiting, that he presented with that is not Ebola. Could be typhoid fever, could be malaria, could be just a GI bug he picked up when he was in West Africa.
You know, when people think Ebola, a lot of times we go back to Outbreak and some of the other movies we've seen about this, where they really think it's much greater than that. When you think about blood coming from different areas and from eyes, those aren't the symptoms that he showed, are they?
Well, the symptoms that he showed were symptoms that are compatible with Ebola, because those are symptoms of high fever and nausea, vomiting, diarrhea.
I heard you correctly. You said you think it's unlikely at this point.
I've said it is unlikely. We believe it is unlikely.
Why is that?
Because there are lots of other things that would explain his symptoms that are much more likely to have occurred. And his course in the hospital, as I say, is stable and improving.
So it's the CDC you're waiting to hear back from, and that's when you'll have an absolute confirmation?
That's correct.
Dr. Davis, we really appreciate your coming on to.
Okay, so as you can see, this was a good move by Mount Sinai. First of all, it certainly shows they're in control of the situation, that the CEO he did a great job in explaining what the symptoms are and what they're not, what else it could be. That's a real public service. So a really good job in improving the reputation of Mount Sinai Hospital to allay people's fears, not just in New York, but around the world. So this is a good example of what, if you're watching and you're a hospital executive, what your hospital can do in your community. And look, I'm sure that already medical institutions, healthcare agents are getting inundated with media requests for interviews. And this was a good way, certainly, to use the CEO to show that you're in control of the situation, that you're knowledgeable about the crisis, and that you've really thought of almost everything you can to allay public fears about this virus. So good job there by Mount Sinai. I also want to turn to their Twitter feed, Mount Sinai Hospital again. This is their Twitter feed. And what we're looking at here is just the last few hours. And as you can see here, for example, they're talking about, could there be an Ebola outbreak in America? And one of the doctors did an interview with MSNBC on that, which is good. Also like this a lot, Mount Sinai shared information from the Centers for Disease Control, which is, by the way, at CDC.gov, about the symptoms of Ebola, reaffirming what they know and what their medical staff is talking about as well, what the CEO just talked about. So they're sharing information across lines. This is also a really good public service. It's not their own tweet, but they're saying American health officials have advised against non-essential travel to these African countries. Again, using the hashtag Ebola here, you can see, is a good idea. That will draw attention to this tweet. The earlier tweet before that talked about the countries where the virus outbreak is centered in, Sierra Leone, Guinea, and Liberia, quoting a New York Times article. So, folks, with your Twitter feeds, it's not just putting out your stuff, it's sharing information that's relevant to a crisis that impacts your organization. So good job as well by Mount Sinai, even though they haven't, to least to our knowledge, received any patients from Africa as of yet or anywhere else. So I want to turn now to the Centers for Disease Control site and show you their website. As you can see here, I'm sorry, I think it's a little bit cut off on your screen. 2014 Ebola outbreak, right in the middle of the page, top of the page, front and center. You can't miss it. You click on that, it takes you to lots of good information about I'm sorry, one more time. Takes you to a lot of good information. As you can see, the whole page is devoted to the Ebola hemorrhagic fever with some graphics here. The latest information as of today in red, really nice touch there. And then talks about the different ways you can, the virus is transmitted, a diagnosis. I'm not going to click on all of this, but really good job here. They also have some PDF maps here as well, a fact sheet. Let's just pull that up for a moment. Again, a quick and easy fact sheet that you could save to your hard drive or print out. Really good job by the CDC. This is their Twitter feed. I'm just looking at this for the first time just a few hours ago. CDC Emergency Operations Center moved to level 1 response to Ebola outbreak, given the extension to Nigeria and potential to affect many lives. So CDC has a couple, actually 3 or 4 Twitter accounts. There's a CDC Gov, CDC Emergency. I think the other one's called at CDC eHealth. So a whole bunch of Twitter feeds that seem to work pretty well in tandem. And it sounds like, as you can see, they also have CDC Travel. This was something that I actually retweeted, so I thought it was interesting that the CDC is working closely with Customs, the U.S. Customs, at airports to recognize signs of infectious diseases in travelers, and again using the hashtag Ebola. So, folks, when it's not your crisis, but you're involved in the crisis, even indirectly, you want to use the hashtag that people are going to look for in a crisis situation. Obviously, in this case, it is hashtag Ebola. And here they're talking about this ZMapp, which is an experimental drug therapy for Ebola. So they're talking about that explanation as well. They've retweeted an interview that Dr. Tom Frieden of the CDC did with CNN. So all good use of the Twitter feed, keeping people informed through their publication of their own materials, but also media interviews and sharing information from other organizations. So again, a really good job. So we talked about Emory University, we talked about Mount Sinai Hospital, we talked about the World Health Organization, and here finally the Centers for Disease Control. All good examples of how to handle a crisis situation, how to get prepared for the worst. Again, remember I talked about the 3 key timelines in a crisis: before, during, and after. In each of these cases, it seems that before this crisis spread, before this virus spread into the social media and the media world, these institutions have done a good job at thinking about what would happen if a virus of this magnitude got a lot of attention. So as you can see here, we're looking at a Wikipedia entry about the Ebola outbreak, and according to the World Health Organization, as of August 4th, 2014, there have been 932 deaths out of 1,711 suspected cases. I'm trying to make sense of this. 1,070 cases and 603 deaths have been laboratory confirmed to be Ebola. Okay, so it was just the way it was written. So certainly cause for concern around the world. Late today, Wednesday, British Airways, along with 1 or 2 other airlines, have canceled trips to West Africa out of an abundance of concern. I imagine some other airlines will also follow suit. But again, another example of how a virus or a crisis situation like this impacts many different industries, many different organizations. So when you have a health scale like this, you have to, as a business, as an organization, think about how it may or may not affect you. And if it does, make sure that you are prepared for that crisis situation, and particularly your communication channels. So that means your dealings with the media, your ability to communicate on social media. That means Twitter. That means very often Facebook. It may mean using YouTube as well, depending on the severity of the crisis and depending upon whether you are directly involved in that crisis situation. So if you want to comment anything you heard on the show, please use hashtag #TheCrisisShow if you're on Twitter. Please also visit www.thecrisisshow.com for this episode and for the past 78 episodes we've done since June 2012. You could also find me on Twitter at The Crisis Show and at Rich Klein Crisis. Thank you so much for watching. We'll see you soon.